All right. Hello. Thank you all for coming here today to hear our presentation. We are Team 8, and we'll go ahead and introduce ourselves. So my name is Caitlin Weber, and I'm the social worker on this team. And my goals of this case are to resource or manage the resources for Mrs. Staple and her family.
My name is Jonathan Mesa. Thank you for having us. I'm a medical student. I'll be responsible for medical assessment of our patient, Mrs. Staple, and will provide a good segue into taking care of the overall well-being and health of our patient.
Hi everyone, I'm Samhita. I'm the psychology student and I'll be managing her acute distress and maintaining her long-term emotional well-being.
Hi, I'm Jack Petrucci. I'm the dental student in this case, and I will be discussing the dental matters and how they relate to some of the other specialties.
Hi, I'm Brittany Taylor in the field of nuclear medicine, and I'll be in charge of managing her rheumatoid arthritis long term.
Mrs. Staple presents to clinic with anxious disposition, having recently been displaced. She's a 79-year-old Vietnam era veteran. She's dealing with dramatic changes given a natural disaster that has left her at a female shelter. At this shelter, she is now suffering from left below the knee infection. Besides this, she's dealing with a case of multimorbidity, a decrease in function, and systemic barriers that have delayed her care until now.
The Staple family is a tightly bonded group that supports each other no matter what. They include our patient, Mrs. Carla Staple, her husband Hank, son Anthony, daughter Janie, granddaughter Allie, and of course, her pride and joy, Georgie, her Yorkie that is 6 years old. Next. Carla has a strong system of support around her, whether it be her close-knit family, her friends from church, or the local community she loves to be involved in. It doesn't end there. She has the support of the five of us, among many other providers, rooting for her best outcome in this system of support.
Forgive me. As we know, health and well-being are intimately connected. Thus, we use the 5 M's model employed by geriatric medicine to get an overall overview of Mrs. Staples' health and well-being and in more objective measures. We take into account what matters most to her, her mentation, her mobility, her medication interactions, and complexity in general.
And as an interprofessional team, we agreed that it's really important that we find ways to build rapport when we meet with Mrs. Staple. And so given that she has not had a great experience in the medical system or not feeling too comfortable, we think that these questions would be valuable in asking her to make her more comfortable in the process. Okay.
Some situational and electronic barriers that Mrs. Staple faces include economic deterrents, such as her living expenses exceeds her income, and also the current shelter that she says that the VA is not partnered with. Another barrier that she faces is the lack of internet power and the accessibility of her electronic health record that might limit her healthcare. Next.
So my role as a social worker is to kind of address some of these barriers and working with resource management, all while taking a trauma-informed and strength-based approach. So my first goal is getting Mrs. Staple connected with the VA. They have a program called the Disaster Emergency Medical Personnel Systems Program, and we ourselves are a VA dispatch team, our interprofessional team. And I'll be managing and communicating medications to her primary care and getting her set up with a My Healthy Vet network so she can frequently speak and accessibly speak with the VA. I'll be bridging the gap between the VA and non-VA care services. I will also be documenting the 3-day gap that she had in her medications and advocating for urgent refills. And if these delays persist, applying her for medication assistance programs so that she can avoid paying out of pocket. Um, and then also, I'll be assisting her family in getting resources through FEMA getting this application process started to get repairs and compensation in her home, and filing a claim with her insurance, as well as getting her medical insurance set up, and with everything with the VA, so she's not paying for any of our appointments out of pocket. I'll also be doing some evaluations. I want to evaluate Mrs. Staples' overall health and well-being. It's noted that she is in urgent need of mobility assistance. She's displaced from her home. She's experiencing grief, and there's a possibility of relocation. And all of these things have intensified her feelings of helplessness, frustration, and guilt. So first, I'd like to do the SLU rapid geriatric assessment, and this will address things like frailty, nutrition, muscle loss, and cognitive ability. None of these are diagnoses from this exam, but I'll be able to refer out to John for any physical health concerns. I'd also like to do the geriatric depression scale. She's gone through a lot of traumatic events and now this natural disaster, and she's lost a friend. So I would refer out to Samita for psychological help after this. Next, I'd also like to evaluate Mr. Staple and do the caregiver burden self-assessment, so he can better care for himself and his wife, and offer self-care suggestions. I'd also like to speak with Mrs. Staple about getting an advance directive, healthcare directive, and a power of attorney to ensure that her goals and needs are met, even if she is not cognitively able to do this at some point. And this will include questions like what matters most, like John mentioned earlier. And then some long-term goals, getting Mrs. Staple, Mr. Staple, and Georgie back into their home, if possible, and if not, heeding to her wishes of staying near family and community. And then working with other professionals that aren't on our team, such as OT and PT, to increase her mobility and autonomy. And then applying for VA benefits regarding her disability and applying for new claims for her lupus and hearing loss. And then also connecting her with Meals on Wheels to ensure she has nutritional support.
Given delays in infection management due to a lack of coordination, it is absolutely imperative that we take a look at the wound site. She has an infection below the knee amputation site on her left side. We would like to inspect after having taken a thorough history and promptly begin empiric antibiotics. Should there be purulence at the site of infection, we will take cultures, and should the infection proceed to be more deeply, we would engage in imaging. We would refer to OT, PT, for the purpose of encouraging mobility as we handle the infection, hoping to soon be able to refit the prosthesis. It is imperative to engage in patient education, involving the family and providing enough resources that so daily wound and skin checks can be done, as well as bandage changes. Patient will be informed on the red flags of infection. Thank you. Among her problem list, we see 2 inflammatory and systemic diseases in RA and lupus. She is taking an immunomodulator for this scenario. Our plan at the moment, considering the infection, is to hold the immunomodulator and use the minimum effective dose of prednisone. We would educate in terms of the response of this medication change, as well as the further medication changes that we will make. In terms of cardiovascular risk, she suffers from uncontrolled hyperlipidemia and hypertension. We encourage the control of nutrition, and we will consult further for this matter. We encourage the consistent logging of blood pressure. We will check for orthostatic vitals in clinic, and we have a goal to reduce LDL by 50%, triglycerides to 150, and hypertension to at least below 130/80, making appropriate changes to hypertensive medication. In terms of her functional health, we see fatigue, deconditioning, malnutrition associated with her diet, and overall lack of activity, given the pain and suffering associated with these illnesses. We have proposed, as I said, PT, OT, exercise as much as the patient can tolerate, consult to dietetics. Given a recent decline in cognitive function that was transient, we would like to avoid delirium by filling in sensory gaps, having consistent sleep patterns, having cognitive exercise to delay progression of delirium and potentially dementia in the further life course. In terms of quality and life counseling, we refer to our psychologist, Samhita, who will address grief, stress, caregiver strain, and isolation. We will consider the family's role in this and provide resources. Continue. As mentioned, nutrition, our patient presents with cachexia and other signs of malnutrition. Thus, we would like to consider a well-balanced diet despite the conditions of our shelter. Caitlin will organize in terms of providing meals and adequate nutrition. In terms of lab, we have the following to be considered to evaluate disease progression, CBC, culture, and to assess the safety of our medication changes. We would keep a track of BMP and liver function. In terms of her signs and symptoms, besides comprehensive physical examination, we would keep a watchful eye over electrolytes, iron, and her overall vitals.
Okay, and from the psychological side, when I meet with Mrs. Staple, I would definitely summarize that what she had talked about with Caitlin, our social worker, but I would also like to understand how she's feeling from her own words. So I'd ask her to describe that. And then we would go into explaining why we think, as from the psychology side, she would benefit from therapy. And given that it was mentioned that she doesn't really like to ask help from others, we think it would be beneficial to reframe therapy as a collaborative tool and to empower her while she is in therapy. But before we enter into saying that she should join therapy, it's definitely important that we ask her if she would like to proceed with therapy. It's important to have her consent and see if this is something she would be interested in. And in terms of assessing her mental health, there's something called a cultural formulation interview. And this would be asking questions about her culture and different intersectional identities. And in doing so, we can incorporate these different identities to tailor therapy treatment. And so right now, we think it's critical that we screen for suicidal ideation, given that acute grief she's experiencing with the loss of her home and her church friend. We also want to check in on her depression symptoms, given that we saw an elevated geriatric depression inventory scale score that Caitlin, our social worker, implemented. And so we'll be monitoring her depressive symptoms as we see her in therapy, using something called the back depression inventory too. And that's something we would provide weekly. And we also want to screen for post-traumatic stress disorder. And in terms of treatment goals, given that in the last 24 hours, she was appearing more withdrawn, less responsive, and struggling to recall the name of the nurse, we think that there's some trauma-related dissociation that's occurring. And we think it would be beneficial to teach her these 3 coping techniques that she can practice when she's in a medical setting and feels that she's spacing away. And we also think it would be helpful for her to reframe the situation as your mind is like learning to keep yourself safe by stepping back when you feel these things. And in terms of her having difficulty with accepting help, as self-reliance is something that is a big part of her identity, and her having issues with the physical limitations that she's experiencing, we think that it would be helpful to implement acceptance and commitment therapy to address that loss of identity she's feeling. And through this therapy, she will learn to be more mindful and present with the pain of dependence and the changes in mobility. She'll be able to accept that frustration and guilt that exists without any judgment. And then we'll be going over with her on how to explore her core values of service, discipline, and perseverance to allow her to continue living her life with purpose in new ways. We also want to try to leverage her passion of teaching and volunteering and try to encourage this as something she can do given the certain limitations she's experiencing. And given that she's lost her home and a significant friend, we think that we should be able to work together to anticipate triggers, debrief the feelings she's going through, and identify coping tools. So together we'll be managing that distress and processing those memories and grief. And we think that we can do this using ACT to support acceptance, meaning making, and reconnecting her with her social support of her faith, with her faith and community members, which is her church. And with her increasing physical limitations, she's been feeling like she's a burden to her husband. And so to address this feeling, we think it would be helpful to invite Mr. Staple for a few sessions together, and then we'll go over that caregiver burden assessment that Caitlin administered, and we'll try to get everyone on the same page and see how we can move forward. And we also think it'd be beneficial to include the son and daughter in one of the therapy sessions, given that they were expressing issues with the father taking on too much. And so it would be helpful to ask our social worker on some formal support resources if they are interested in that. And yeah, so it's important that we also address her increasing social isolation. And so for that, I'll hand it over to Brittany.
So some future community engagement goals would be for Mrs. Staple to return to her volunteering that she normally does. She's interested in religious affairs and veteran engagement. The project, such as the Wounded Warriors Project, is the social project that connects veterans and with members of other veterans in their community. And a Christian Life community is a social support group that holds spiritual exercises. Also, the United Ways volunteering is an opportunity throughout St. Louis that provides numerous of volunteer opportunities that will probably be accessible for Mr. Staple. Next.
You can go to the next slide. One more. There you go. Okay. Sorry. The immediate priorities when it comes to Mrs. Staples' dental treatment are the refitting of her partial dentures to reduce and eliminate the pain associated with her ill-fitting dentures, assess the causes of her jaw pain, including the TMJ dysfunction, cavities, and periodontal disease, investigate her remaining teeth for dental caries, and if the cavities are found, evaluate the necessity of filling the cavities at this time, and analyze the possible periodontal disease risks, which would be looking at the gum tissue health and any bone loss. And we also want to adapt her toothbrush to make it a little easier for her to brush her teeth with her rheumatoid arthritis. And we would do so by adding a tennis ball to her toothbrush. Next. And then the future goals that we'd want to pursue in the dental field are to refit her partial dentures or make a new one if the refit did not work out long term. And we would do this if Ms. Staples has sufficient funds and when medical care becomes more available after the disaster, working with the primary care provider from the VA before invasive procedures to avoid any possible complications. And finally, consulting a dietitian if dental and jaw pain does not resolve to ensure a nutritious diet for Ms. Carla.
Some goals that nuclear medicine have for Mr. Staple, it would be long-term monitoring of her rheumatoid arthritis and possible infections. Due to labs being provided early on in a clinical diagnosis, I don't think nuclear medicine is necessary. This one makes treatment more affordable for Mrs. Staple. Also, given the fact that Mrs. Staple tends to avoid healthcare settings due to PTSD, it would not be wise to use nuclear medicine in initial diagnosis due to her other recent stressors from the flood. Thus, when it comes to long-term monitoring, there are two scans that can be used, an FDG PET scan and a bone scintigraphy scan that can monitor the inflammation of her rheumatoid arthritis and bone infection. The bone scintigraphy scan would be more affordable for Mrs. Staple and should be used in the case. Next slide. Another way to help out Mrs. Staple is to provide support for Georgie. Georgie is currently not liking his situation in a shelter. Care St. Louis is a dog fostering service that provides temporary location for pets during a time of need. This will allow Georgie to have more social support and environment to roam around than the shelter would. Next.
We would also like to acknowledge the potential of other referrals, as we've discussed throughout this presentation. So physical therapy to increase her strength and mobility, occupational therapy for essential everyday tasks, and then a dietitian to ensure her diet is healthy and sustainable.
Okay, and in terms of how all of our professions overlap, we see that all of us incorporate cultural and ethical care. We all provide patient education. Psychologists and social workers both address emotional well-being, community resources, and our dentist, doctor, and nuclear medicine specialist work on medical management and imaging. So these are references, and thank you. Any questions?